Go recording. Complementary and alternative medicine is something that has gotten some airtime recently. And so we'll explore more of those things and have a chat about them on Wednesday. The first thing we need to do is discuss the placebo effect. Because that matters before we start talking about complementary and alternative medicine. It matters. It's not a suggestion that CAM is worthless, but it does bear a lot on the discussion, which is why it's called complementary and alternative medicine. Okay? So let's talk about the placebo effect, shall we? I got rid of the video to start us out, so unfortunately, we're just going to talk about what a placebo is. So, placebo is Latin for I will please. Okay? And, it's like, I will please. It's I will please. Like, I'm gonna please you. That's what the please means. I will please. I will make it pleasant. Okay? Now you know where placebo comes from. Now you know why these things are called placebos. Okay? So with the context that we're talking about today, now the definition of placebo is much greater than what I'm going to talk about for this class and going into Wednesday's class, because we're just focused on medicine here. Okay? And that is the medical procedure or ingestible, okay, then it provides the patient with therapeutic intent, or therapy by its intent, not its specific nature, okay. So, this is the definition that we're going to run with, something that happens to you or you take, which doesn't necessarily give you any direct benefit other than the intent of the benefit. And this will become clear as we go through. FCAD script. Alternative medicine is a classification for any medical treatment that does not exist in traditional Western medicine. So anything that is not accepted by traditional Western medicine is alternative. Okay. This was combined with complementary as something that people do to expand the medical options for traditional medicine. Okay. So that's what alternative medicine is. So the most common thing that you've likely heard of, and I've talked about in research methods quite frequently, is sugar pills, right? These are lactose pills that you take, and really all it's going to do is give you a jolt of sugar, and that's it. It's not going to give you any sort of benefit. So if you take a sugar pill and it's supposed to lower your cholesterol, somebody's been fooling you, okay? Some famous placebos that have existed in history. Teriac. Teriac was a concoction formulated by the Greeks in the 1st century AD. And it made its way all the way to China following the Silk Route, which is pretty cool. It was a sort of an elixir, a panacea, if you will. So, if you're not familiar with panaceas are cure-alls. Okay. And this Teriac as a panacea was given a name in the 16th century. He was like, well, it seems like Teriac is kind of like what people are saying about garlic now. Because I'm sure you've heard garlic can do a whole bunch of stuff for you, right? A lot of it can, right? Here's the problem. Teriac doesn't actually do anything. It doesn't do anything for you. And if you take too much of it, it will kill you. It will kill you. So, and then of course, unicorn's horn. Unicorn's horn. All you have to do to get unicorn's horn is to kill a narwhal, cut it open, and grab the unicorn out of there, and then cut off its horn. Right here. Right here. Yeah. That's how you get unicorn's horn. Obviously, I'm joking. You find unicorns in the enchanted forest. Mandrake. Mandrakes. Oh, by the way, with unicorn's horn, there's actual history with this. It was actually narwhals. But it's funny because people are gullible. But what's funnier is that narwhals, their horns are just a giant tooth. So they're not even horns like you would get from I don't know, who even has horns? I don't, no tusks. Horns. No, horns. Rhinoceros? I don't know. Yeah. People are dumb, right? Mandrakes. So, mandrake root from Harry Potter. When it's a baby, it screams, right? And when it's full grown, and that scream sucks, right? And then when it's full grown, if you hear it, you dead. Okay. If you don't get my Harry Potter reference, well then, we can't be friends, I'm sorry. But real mandrake root is actually a hallucinogenic. If you take a lot of it, it can produce unconsciousness. That is, it will make you pass out. And it used to be used for anesthetic, for surgery. Because if you took a lot of it, you would just go unconscious, right? Good old narcotics, right? Now, it was used to treat rheumatic pains in your joints. It was also used to treat melancholy, convulsions, mania. Is essentially acting as a narcotic in that case, right? But if you had too much of it, it could create delirium and madness because of its hallucinogenic properties. So, you know. And then, of course, any other Tom, Dick, and Harry that may have come across saying, buy my product. It can do all the things. Snake oil salesman, that's where that comes from, right? So what causes a sick person to get better? Okay. Now, the first one is pretty self-explanatory, I guess. This is called the natural history effect. Illness just runs its course. We can say that is true for a number of people who have achieved wellness after getting COVID-19. Okay. Or the illness just runs out of steam. It can no longer make copies of itself. The microbe that is causing the illness. It just goes away. That's the easiest one. Okay. Second option is that a treatment specifically altered the course of the illness or disease. Okay. So a good example of this one would be a piece of willow bark. To treat your pain. Now, what willow bark is that? Well, it's aspirin. Natural. Okay, it's made from willow bark. It treated the pain, and it made the pain go away. It's a blood thinner. Okay, so don't eat too much aspirin, or your heart cannot pump your blood. Okay. What we're gonna focus on is this last one, is non-specific effects of the treatment made the person get better. And this is placebo effects. Okay? This is placebo effects. Alright. So, the kinds of placebo tests that we are going to encounter as we go through this material are called placebo-controlled double-blind studies. Placebo-controlled double-blind studies. Okay? So, we have a treatment condition that gets the active ingredient, reason number 2, for treating the ailment. And then we have another group of people that get the placebo, which is made to look like the real thing, made to feel like the real thing, but not actually the real thing. It's missing everything about the active ingredient, okay? And you people are randomized to those. Now, the researchers and the participants do not know that they have the placebo or the active drug. They don't know. Okay. Oh, I guess I could put that up. There we go. So, experimenters, researchers, and patients do not know which one they received. Okay. Now, if everyone gets better, we know the drug isn't better than the placebo. That's seemingly a failed drug trial in this case. However, since we don't have a baseline of reason number 1, the natural history effect, then we actually don't know if there is a placebo effect. You need to test all 3 at once. You need to test natural history, you need to test the active ingredient, and you need to test for placebo effects. That's 3. That's 3. So, actually, we need to do what's called a waitlist design, or some sort of no treatment, no placebo control. They get nothing. The easiest way to do this, the easiest way to fool people into thinking that they'll take part in the drug trial, is to do a waitlist design, right? So, you have the 2 treatment groups from the last study design, but here we're adding the no treatment waitlist. Okay, so these people don't actually participate in it, although they still fill out questionnaires over the course of time. So, right, they're like, just fill out this questionnaire. When a spot opens up in the drug trial, we'll let you in. Okay, that never comes. Now, if the drug proves, oh god, why did I say that? If the drug appears to be effective, then these people ethically will be entered into the drug trial to receive its benefits. That's the point of this ethical kind of study, right? This design will tell us, as if we're doing it all double blind, okay, will tell us if there are any differences between the drug and the placebo, and if there are any differences between the placebo and the no treatment. Now, that last comparison is really, 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 really crucial for any drug maker who does this properly. Okay? If there is a difference, that is, people seem to get better on the placebo compared to nothing at all, then there are placebo effects afoot. Okay? Now, if the people get way better on the drug versus the placebo, then there's promise for the drug, but we need to remove those placebo effects before we can bring the drug to market. Okay? But again, the crucial difference is between the placebo and the no treatment. Okay? It's very, very important. Okay? And the last point I want to make about these designs before we go through that is you shouldn't consider placebos as not treatment, because they are a treatment. You are giving somebody something. Okay, it's not nothing. And depending on how people behave, how people think, we're going to go over the influences. This can alter the perception and other features around getting better. Okay? Yeah. Measure output. So the first example that I want to tell you about is this set of sham knee surgeries. Okay, and then I'll play a video from I believe this is from Investigation Discovery, I think, something like that. So a lot of people have knee issues, right, Katie? And they get their knees fixed through arthroscopic surgery, which is, pinhole fixing of the tendons and ligaments and blah, 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 all that stuff, right? So in this one, they doctors randomly assigned patients to either get real knee surgery or sham knee surgery. Now, what's double-blind about this? You think, well, the doctor needs to know when they're going into the operating room whether or not they're going to get real surgery or not real surgery. That's the thing. That's how you actually keep doctors in the loop. So the doctors, the surgeons agree to participate in this study, just like, they're probably in on it. They're authors on the paper and whatnot. They actually don't know which patient's going to get what until they're in the OR. That way the patient is under, right? They don't know which one they got. Boom. Okay. That's how you handle double blind. Okay. And the people who got the sham surgery, they felt better. No arthritis. So I'm going to show... I'm going to show this clip to you, and it'll explain it a little bit more. 5 minutes. I don't know if we're going to be able to watch all of it.
The idea was to treat people
God.
in great pain. Volunteers with severe knee arthritis were gathered from around the state and divided into groups. 2 groups would have a surgical procedure. The third would be given a placebo, fake surgery. They'd have a general anesthetic, be opened up, but wouldn't have any real procedure.
That's important, right?
They would merely think
because
they had.
Because they had to have the scar from the arthroscopic surgery, right?
For the patients not to know which treatment that they have. And they're always trying to look for clues. They're always trying to get you to tell them. And the best way to avoid
that's
that,
the Mosley that you see in the
which treatment they're going to have.
Each patient would receive a general anesthetic, but only 2 groups would have an actual procedure. Not even the surgical staff knew who was in each group until they were in the theatre.
I would open the envelope in the room and I would read it, but I wouldn't announce it out loud. And then I would show it to the nurses who were working with me, and I would show it to the anesthesiologist, and nobody would ever say which of the 3 treatments was revealed in the envelope.
In case the patient woke up.
We had a very elaborate ruse, if you will. I would play a videotape on the TV of a real surgery. And while I was watching the TV, I would ask for instruments and pass things back and forth and carry on conversation as if it was what I would really have done if what was happening on the TV screen was actually going on during that surgery. So we would
this
have
guy should be on
splashing,
Grey's Anatomy,
we would have
man.
Instruments clanking, and we would do this for the same amount of time that the actual surgery on the videotape took place, so that a patient and their family couldn't watch the clock and say, oh, we were only in the operating room for 10 minutes, so it must have been a pretend surgery.
Yep.
All this acting felt a bit weird to a doctor trained in standard surgical procedures.
In the big picture, always in the back of my mind, I was thinking, good gosh, here's a patient who we're pretending to do surgery on. We're not really doing surgery. And, you know, I'm a physician and a healer after all. And is this kind of really, you know, the right thing to do? Or what have I gotten myself into?
What have you done? So I'm
It
gonna...
took 2 years for the study to be completed. Finally,
years.
it was time for Dr. Mosley to hear the truth from the patients themselves.
I would say, if you think that the surgery helped your knee, I want you to give me a thumbs up. If you think the surgery didn't help your knee, I want you to give me a thumbs down. And if you're not sure or you're kind of neutral, just hold your hand flat. Twist your knee
The verdict? Success for every group, fake or genuine. Sham surgery had worked. The patients who had it were astonished.
The response ranged from, you got to be kidding me, I can't believe it, bewilderment, there must be a mistake, because they all felt so strongly that something had happened to change what was going on inside their knee.
During your training, what were you taught about the placebo effect?
Nothing. I had no clue. I went from being a skeptic to a believer. I realized that we were really onto something. There are clearly cases where we do surgeries and it's as much or more the patient's feeling about the surgery that influences the result as the actual surgery itself.
Effect could still hold.
Okay, so this is one of the
When I
patients.
first had that pain, before that, I couldn't do a lot of things I did. Like going fishing or playing basketball or going dancing. And after that, I was able to do that.
He could. Woo. We could go dancing. He took me dancing, and he could dance all night.
Can you describe what the pain was like?
This
before the
is one
operation?
of the sham
Terrible.
folks.
I didn't think that it could be any worse.
It's emotional. What?
That is kind of a intriguing question, you know, because I got to credit Dr. Mosley for doing what he did. But it was my mind that cured the problem.
Boom! My mind killed the problem. It's pretty cool, isn't it? I think that's pretty cool. That's pretty cool. All right. Let's talk about the four ways in which the placebo effect is influenced. Okay. So, the behavior of the healthcare provider is incredibly important for the placebo effect to work. Okay. If the doctor exudes, oh my goodness, if the doctor exudes warmth, confidence, empathy, and reassurance, well, that's going to be much nicer than the doctor who's like, nah, take this, whatever, it'll work. I don't know. I don't even know what I want to hear right now. I don't really want to be a doctor. You know, that sort of thing, right? At first one, I'd be like, oh my gosh, it's amazing. The power of this drug is wonderful. I mean, not really, but... So, a study done in 1995, or 1956, excuse me. Patients were given a tranquilizer by a doctor. Either the doctor was a person who expressed confidence in its treatment. Chlorpromazine was the tranquilizer. This was given to, help people deal with anxiety, I imagine, back in 1956. So, doctor said, yeah, this is amazing. It'll do what you needed it to do. And then there was another doctor who said, I don't know if this is going to do anything about it, right? So when the doctor expressed confidence in this effectiveness, it was found effective. 77, oh my goodness, I can't talk today. 77% of patients report it being effective, okay? When the doctor expressed doubt in its effectiveness, only 10% of the patients said it was effective, okay? It's quite a difference, right? 77% to 10%, boom. They show that the health provider matters. This shows that the health provider matters for patient outcomes, right? Much more studies than... Oh, I could have put that up, sorry. It's there. The characteristics of the patient also play a role, right? Are you a true believer or are you a skeptic? Okay? If you don't believe the treatment, whether it's good or not, is going to work, then you don't care. And it's not going to work. Okay? Now, if you believe it's going to work, even if it's not effective, it may still work if it's a placebo. Okay? Oh, look! We have an Ellie sighting. She uses annoying. It's super effective. No.
Daddy, look! You look funny!
Thanks.
Daddy, you have a naughty face.
I have a what face?
Daddy, you have a new face.
I have a new face?
Daddy, you look funny.
Alright. She's begun a fake laugh now.
You're moving, Daddy.
She's moving my chair back and forth now. Okay, so I'm going to tell you about situational factors or characteristics of the placebo. I'm going to play you a video of that.
Now, you've all heard of the placebo effect before, when something with no known therapeutic value can actually make people feel better. It's a great trick our minds play on us, that by believing and expecting something to work, it actually does. But what's weird is that the strength of the effect can differ for some really strange reasons. For example, the same placebo can treat pain half as well as aspirin, while at the same time treating pain half as well as morphine. Morphine's a much more powerful painkiller, but a placebo is half as effective as both? Saying a placebo will reduce pain reduces pain, but saying that the same placebo will increase pain increases pain. Believing that a placebo will make you feel better will make you feel better. Believing that it won't has the opposite effect. Now, placebos aren't just pills. They can be creams, injections, surgeries, or drinks. You can even get placebo buttons. They don't actually do anything, but they sure as hell make you feel like you're in control. But not all placebos are equal. The effect of the placebo is bigger when the pill itself is bigger, or if you have 2 instead of 1. Or 2 once a day instead of 1 twice a day. And a capsule will usually beat a pill, and a syringe will usually beat a capsule, and anything with a big ass science machine can outperform any of them. A plain pill works worse than a branded one. A discounted pill works worse than a pricey one, and even a pill in a plain box does worse than one that's all shiny and shit. Placebos that are blue work best as downers, and placebos that are red are better as uppers. Studies have shown that people who take their meds on a regular basis are less likely to die than those that don't, even if those meds are all placebos. You can even get addicted to placebos. In one study, a group of women took placebos for more than 5 years. 40% of them suffered withdrawals afterwards. In fact, the effect of placebos can be so strong that some people want them banned from sports. But I mean, how would you even test for that? Placebos don't even seem to work from place to place. For example, in Germany, using a placebo to treat ulcers works better than anywhere else in Europe. But using a placebo that treats hypertension doesn't work nearly as well as it does for its neighbours. Now, remember that all of this is about comparing things that both have nothing medically effective in them, which goes to show that a placebo isn't about what's in it, but about the beliefs that we load onto it. Our minds create the medicine, and that is pretty freaking weird.
And that is pretty freaking weird. Thanks, Daniel Kogue. I think. So you see, the characteristics and the situational factors play a role in your belief. And to round us out on the influences here, cultural beliefs. So, what you bring to the table as far as your culture and what society has said about it. So what I want you to do in chat is let me know any non-traditional treatment that you or your family have discussed to treat things, right? I'm talking about non-traditional stuff. Let me know in chat what sorts of things that you or your family and generations upon generations have discussed and to control or treat some sort of illness. Be specific too. So if you name a treatment, say what it's what treatment it's for, right? Essential oils and chiropractors, but for what, Deanne? For what? Drinking lemon juice for hiccups. I like that one. I've heard that one before. Essential oils for migraines. Okay, alright. Yeah. My parents have gotten on that train. Drinking ginger ale for stomach aches. Okay. Ginger ale and Vicks for freaking anything? Prune juice for anything? Oh my goodness. Well, prune juice. Prunes are a natural laxative. So if you are having trouble, if you're constipated, then drinking prune juice would be a good idea. Sprite, yeah. Ginger ale or Sprite. Vicks Vapo Rub on the bottom of your feet with socks on for colds. Right. Okay. Spoonful of Coke syrup for stomach aches. Coke syrup? Like, the syrup that's in Coca-Cola? Chiropractors for back pain. I mean, they can adjust you. Chiropractor for back and neck pain. That's not really all that cultural. Vicks on the bottom of the feet for a cold and runny nose. Essential oils for headaches and studying. Sprite to help with stomach pain. Well, if Sprite is helping your stomach pain, then Coke should do the same, right, Katie? Epsom salt baths. Epsom salt baths for joint pain and inflammation. Epsom. Multivitamins for any illness. Multivitamins aren't going to do any illness. Greasy food for hangovers. Nah, that's just feeding your body. But I like it. Whole family goes to the chiropractor for back pain. See, chiropractors are fine for joint adjustment. We'll talk about chiropractic on Wednesday, but fine for actual joint adjustments. I would consider them specialty orthopedists, essentially. Freezing cold washcloth for migraines. Freezing cold? Oh boy. Did praying and put holy water on my forehead and my doorknobs for my depression. That's not cultural, but okay. It's interesting. Very interesting. Dad's side believed that a salve will fix any injury. But what salve? Yeah, religion. Okay. Pray the problem away. Yeah. Okay. I can buy that. I can dig it. Interesting ones, y'all. Now, so obviously we're going to talk, obviously, this is what influences the placebo effect, cultural beliefs. Do any of you believe in those things that have been passed down by your families? Okay. Do any of you believe it? I love the talk about getting a shot of whiskey for a sore throat. It'll fine. The alcohol will kill all the bugs. Wrong hole. But, unless you could, get the alcohol down your throat without drowning, I can dig it. I can dig it. I can dig it. Finally gone. Ginger ale and Vicks. Yeah. So, the ginger and the menthol, and the menthol that's in Vicks, obviously, do have therapeutic properties, and they are accepted by traditional medicine. But the thing is, again, you have to believe it for it to work. If you don't believe that it's going to work, then it's not your cultural belief. Okay. I've heard some wild and crazy ones. One that I have, and so this was from UCSB. So there's a lot of different cultures in Southern California all mixed in. Ask them this question, and it's just like, wow, that I've never heard of that. That's all right then. So, in Latin American cultures, there's a lot of superstitions. African American cultures, there are a lot of home remedies. And those go all the way back to slavery days, because slaves were not treated in the same way by doctors. And so a lot of mild things had to be treated with stuff they had in their homes. Off days, yeah. Oh yeah, feeling bad, eat some soup, yeah. Good old Campbell's chicken noodle. I gotta say, part of that, as far as American culture goes, just broadly speaking American culture, marketing. Marketing made Campbell's soup the staple for, Campbell's was like, eat this soup. Became a bug in the ear of women in the 1940s and 1950s, and then boom. If you just keep that marketing train going, you go. Gold mine for Campbell's. Okay. Carbonation helps the bubble guts. That's an interesting phrase. Oh, man. Okay. So, I mean, I think we all kind of see where some of these are going. Okay. And to round us out here, we gotta finish up placebos here. So, to sum it up, to sum up some of the stuff that we've talked about, what strengthens the placebo effect? So what influences, and then what makes it stronger? So what increases the effectiveness of it? Okay, so obviously the confidence and worth of your healthcare provider, believing it will work from the patient. The more medical seeming and the more expensive something is will make it, of the placebo will make it stronger. And then social norms. So faith in modern medicine. Placebos help more Germans than Brazilians because modern medicine, which is Western, and so therefore placebos in this case, medical seeming more expensive, believing it'll work, all of this stuff occurs in Germany more than it does in Brazil. So, how do they work? Well, one reason is they could decrease anxiety associated with the illness, okay? Which could then also decrease the physical symptoms of anxiety, because we've already talked about stress, right? And stress and anxiety go hand in hand. And those symptoms could be upset stomach, diarrhea, trouble sleeping, etc. And so just knowing that you are getting treated for the thing that you are getting treated for, even if it's a placebo, might help. Okay, and so it might also improve your mood, which will then increase physical symptoms, right? Improve physical symptoms. Endorphin release. So we talked about pain killing from the endogenous side, the endorphins, right? The endogenous opiates that are made by your body. So when you are experiencing pain, you want that pain to go away. And endorphins are going to release. And so if you take a placebo, then this might have a feedback of releasing endorphins. The issue with endorphin release, as far as how placebos work, is it has to do with pain and pain only. Okay, doesn't account for all placebo effects, only pain-related ones. Classical condition. I'm going to skip the global versus local effects, because this is how the endorphins work. Okay. Classical conditioning. Okay. Classical conditioning. Anything that's associated with medicine could make you feel better. Okay, so if just going to the doctor's office, maybe the doctor doesn't actually do anything for you, just makes you feel a little bit better. It's because you are classically conditioned to feel better once you encounter the stimulus of the doctor. Okay. What it doesn't account for, though, is all of the ways that placebo effects can help. All of the ways that placebo effects can help. So this is not a very good explanation. So explanations 1, 2, and 3 maybe explain placebo effects working, but they don't, generally speaking, show the full thing, right? So, Ipecac, which is a drug, not a drug, but it's a natural substance that makes you vomit, right? If you take too much of it, it can actually decrease your nausea, right? And you can also make people feel pain by injecting morphine into them. All you have to do is tell them what's going to happen. So these aren't actually classical conditioning effects, because you can modify the way that the effects occur in the body just based on one simple thing, and that is changing the way the patient understands and expects the treatment to work. Expectations. So if I were to place my money on the explanation that best serves all placebo effects, it's number 4 here. Okay? Not number 1 might work for anxiety stuff. 2 might work for pain stuff. 3 might work for stuff occasionally, but you can modify the conditioning by doing number 4. So as far as explanations go, if I can change my expectations, then I'm actually going to loop in number 3, number 2, and number 1 into my broader expectation argument, okay? So expectations are interesting, okay? So you don't have to have any prior experience, which is good. Or bad, depending on how you're looking at this, okay? But the more believable the placebo, like in the video that we watched, the more likely you think it's going to work. A nocebo, which is the name for a placebo that does the opposite of an active drug, okay, can do the opposite of that drug. So that's called a nocebo. So you can actually turn a placebo into a nocebo just by saying, hey, patient, this is going to make you feel like garbage. Good luck. See you later. Okay. And then finally, the other piece of evidence that supports the expectation argument, there are no placebo effects in the absence of expectations. If you do not say a single thing about something that somebody's going to take for a medical treatment, then it's not going to work because there's no expectation. Especially if there's no prior experience with the drug, then no placebo effect in the absence of expectation. That's pretty conclusive to me, okay? I'm going to skip this one. Oh, yeah. Read the Silberman and Talbot arguments. Placebos are getting stronger and getting rougher as far as, like, what we should do. Nocebos. You can induce hair loss, nausea, medical student syndrome by telling people, this is what you expect from this sugar pill, right? These are placebos that cause harm, okay? So we are going to end there, and we are going to pick back up with should doctors prescribe placebos, and then we are going to go into CAM, and we're going to spend all of Wednesday talking about complementary and alternative medicine with this placebo base underneath us. So